Welcome. Thank you for joining us today. I'm Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Before we get started, I just want to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you're in listen-only mode. Everyone has mute, so we can hear our guest speakers today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and our guest speakers will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask a doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to complete. Your feedback is important to us as you plan future programs. All right. So next, I would like to introduce you all. We have Dr. Joanne Doyle Petrongolo. She is the pharmacy coordinator for the Integrated Care Management Program at Massachusetts General Hospital. She received her BS in pharmacy from Northeastern University and doctorate of pharmacy from the University of Rhode Island. Dr. Doyle Petrongolo joined the Mass General team in 2005 in the outpatient pharmacy. In 2007, she became part of the Integrated Care Management Program and worked with case managers and social workers in resolving medication issues in a high-risk population. Currently, her main focus is on patients in the primary care setting, where she works proactively in preventing admissions by resolving polypharmacy, medication adherence, and medication access issues. Dr. Doyle Petrongolo has given many presentations on geriatric topics, including polypharmacy, medication access issues, fall prevention risk assessments, and participate on several medication safety, discharge process improvement, and care redesign committees. She is certified Shine Counselor, assisting individuals with insurance issues, and she is also a regular consultant for the Harvard Health Letter. Joining us also, we have Petrece Palmese. Petrece is a dedicated pharmacist at Massachusetts General Hospital's outpatient pharmacy, where she combines deep clinical knowledge with a passion for patient-centered care and education. As a mentor and preceptor, she has guided numerous pharmacy students through IPPE rotations, fostering critical thinking, medication safety awareness, and compassionate communication. An initial collaborator for the same-day surgery program, Petrece played a key role in ensuring post-operative patients received their medication seamlessly before discharge, a model that continues to enhance patient safety and satisfaction today. Known for her creativity and forward-thinking approach, Petrece has contributed to a range of impactful initiatives, from patient experience enhancements and Know Your Meds education stations to digital innovation proposals such as hospital wayfinding and QR-based satisfaction surveys. Her work bridges clinical excellence with design, technology, and storytelling. Beyond her professional life, Petrece finds joy in family, travel, and creative expression. She shares life with her spouse, Wendy, their close-knit family, and their beloved dog, Colby. A creative baker as well, she enjoys crafting delicious treats and beautifully designed confections that bring joy to those around her. Whether planning meaningful trips, baking for loved ones, or cultivating her garden, Petrece approaches everything with empathy, curiosity, and purpose. In recognition of Talk About Your Medicines Month, they are here today to give a talk on what you need to know about taking your medicines safely. So please join me in welcoming them.
Okay. All right, so let's go ahead and get started. I'm going to share our screen. Let's see. All righty. Welcome, everyone.
Hello, everyone. So I'll begin, and I'd like to thank you all for joining as well.
Yeah.
Okay. Oops. Next. Nope. So the objective is to explain why medication safety is important, especially in older adults, provide recommendations for safe medication use, and offer suggestions for medication storage and disposal. Yeah. So we're talking about medication errors are more common than most people think. Every day, thousands of people experience mix-ups with their prescriptions, sometimes in hospitals and sometimes at the pharmacy, and more often at home. The truth is, the more medications you take, the higher your risk becomes. It's not because you're doing anything wrong. It's simply that managing multiple prescriptions can be very, very complicated. Think about this. Different doses, different times, look-alike bottles, sound-alike names, all of these can lead to confusions or mistakes. And I would imagine many of you can relate to this. That's why it's important to double-check your prescriptions, ask your pharmacist or provider questions, and keep your medications organized in a safe place. A few extra minutes of attention can prevent serious errors and keep someone such as yourself or someone you know safe at all times. Thank you. As we get older, it's not uncommon to take several prescription medications, maybe one for blood pressure, one for cholesterol, sometimes for sleep or pain or over-the-counter meds. But many people also use OTC medications, vitamins, and herbal supplements. And that's where things can get very, very tricky. These products can interact with prescriptions, sometimes causing unexpected side effects or making your medication less effective. Our bodies also change with age. The same dose that worked probably maybe 5 years ago can no longer have it may have a stronger effect now, or it can increase risks of falls, dizziness, confusion, or other serious reactions. Our bodies change. So before adding anything new, even something you can buy without a prescription, talk to your pharmacist, talk to your provider. A simple conversation can help prevent a diagnosis mix-up. So we have the 7 steps. Now that we understand where medication errors can happen, let's talk about these 7 steps. Step 1, be informed. Know the name of every medication that you're taking. What's it for? How does it work? Read your medication guide, as your pharmacist is there to explain in your language. And I can tell you at Mass General Outpatient Pharmacy, we have several ways of informing patients and making sure that they understand in their language. We have something called Meducation, and which provides basically a clinical record of how you're taking your meds in 36 different languages. Communication. Always share your full prescription list. Prescriptions, over-the-counter items, vitamins, herbals, eye drops, ear drops. You'd be surprised. Share them with your doctor, your nurses, your pharmacist. Again, good communication keeps everyone on the same page. Check your medicine. Before you leave the pharmacy, check the bottle. Make sure it's the right name. Medication, dose, directions are correct. Sometimes things might look different. And if they are, there's something wrong. Speak up. Use your medication correctly. Take each dose exactly as it's prescribed. Don't skip doses or stop just needlessly and say, this isn't working for me, because you'd be surprised sometimes what happens. You can have serious side effects from that. Again, store your medication safely and follow timely instructions as well. Be aware. Watch for side effects and how you feel. If you're experiencing dizziness, confusion, stomach upset, report it right away to the doctor, report it to your pharmacist, report it to your nurse practitioner. And there's many ways of communicating through Patient Gateway as well. Keep good records. Maintain a current medication list and update it whenever there's a change. Keep copies on your phone or in your wallet, most importantly for emergencies. And my colleague Joanne will be going over this later as well. And don't be afraid to ask questions. We're there for you. So remember, being proactive, informed, and involved, this will make you your own best advocate for your own medication safety. The more you know about your medicine, the safer you're going to be. Start by knowing the names of every single medication, including the generic names. Doesn't matter if you misspell them. We understand you. We're pharmacists. So with that said, this helps prevent confusion, especially when your prescriptions change or when you visit different doctors or pharmacies. Don't forget to include all your non-prescription medications as well. Things like painkillers, as I mentioned, allergy tablets, vitamins, herbal supplements. These can interact with your prescriptions too. Know why you're taking each medicine. When you understand the purpose, whether it's to lower blood pressure, control pain, or help you sleep, you're more likely to notice when someone doesn't feel right. And finally, know how much you take and how to take it. Pay attention to the dose, the timing, and whether it should be taken with food or on an empty stomach. The more informed you are, the more confident and proactive you'll be in managing your health. I have a story for you that happened last week. We had a patient that was on a Lipitor 20 milligram. It's used for cholesterol. Her primary care for Mass General prescribed it. For whatever reason, she went to a clinic outside the hospital, and a prescription came in, and it was for double the dose. It was for a Lipitor 40, and she was to take 2 tablets a day. Now, think about this. She was prescribed originally a Lipitor 20, 1 a day. Looking into her chart, I contacted the PCP here at MGH, and I said, I don't know if you're aware of this, but there was another prescriber that prescribed outside of clinic, out of the network, prescribed a 40 milligram. She got in touch with me immediately, thanked me, and said the patient should be on only a 20 milligram. I have no idea why the other prescriber wrote that, but it was caught. And that's the importance of pharmacists and what we do. It all ties into good communication. It's one of the most powerful ways to prevent medication errors. Always tell your doctor about all the medications you're taking, not just prescriptions. Be sure to tell your pharmacist the same information. We might look busy, but we're always there for you. That was one of the oaths that we took, is to care for our patients. This includes also over-the-counter medications, every vitamin, every herbal supplement, everything that you take. And why? Because even sometimes that may seem harmless, like a daily multiple vitamin or a natural remedy. It can change your prescription and how it will increase side effects. Another example, right before surgery, I had a loved one that was going in for surgery. He had to be off every single vitamin, and including his vitamin D, and also his eye vitamin as well. That's something that I might not have thought about, but as if I was a layperson, but as a pharmacist, we have to catch everything. So even though these things may seem harmless, they can increase side effects. When everyone on your care team knows exactly what you're taking, they can help protect you from dangerous interactions and make sure that treatment plans are safe for you. Open, honest communication saves lives. It's important to keep your doctor and pharmacist updated about what happens with your medication. Tell them when you're starting a new medication, even if it's prescribed or by another prescriber. That way they can look for possible interactions or duplicate therapies, similar to what I was just mentioned in the a few minutes ago. Share both the good and the bad side effects, what you're experiencing. Maybe one medication helps your blood pressure, but causes dizziness and fatigue. And that's important for your care team to know. Also, let them know about any allergies. Allergies are very important. On medications, you need to stop right away, even if it's been for a while. If it's cost, it does make it hard to take your medication as prescribed. Speak up. And the reason why is there's generics, there's alternatives, there's discount programs, things that you might not be aware of. That's where we come into play to help. And we'll also reach out to the assistant plans as well. And Joanne will also broach that subject later too. And if you've been taking your medication differently than prescribed, it happens. We see it all the time. Maybe skipping a dose or cutting your pills in half. Be honest. Let us know. Your doctor and pharmacist are there to help to find safe, realistic solutions. We're not here to judge. We're here to help. So good communication is the key to safer, more effective care. Over-the-counter products. When we think about medication safety, most people focus on prescriptions, but you'd be surprised for those over-the-counter products that can be just as powerful and sometimes just as risky. In fact, about half of all the serious drug interactions in outpatient setting involve non-prescription medications. I'll repeat that again. Half of all serious drug interactions in outpatient settings involve non-prescription medication. The most common one is aspirin and also Tylenol. Aspirin can interact with blood thinners, blood pressure medications, and even supplements, and can increase the risk of bleeding and stomach irritation. Another one to watch is acetaminophen, also known as Tylenol. It's found in a dozen cold, pain, prescription combination products. It's easy to realize, since sometimes you might be taking a Tylenol PM, and then perhaps your doctor prescribes a regular Tylenol for you to take during the day. That can cause some serious liver damage. The recommended dose is about 3 grams to 4 grams, and it depends on age. The less you take, the better. More often than not, it's only used for a PRN needed basis. So always read the labels very carefully, check for duplicate ingredients, and talk with your pharmacist if you're unsure. What seems like a simple over-the-counter product can have a big effect when mixed with other medications that you may already be taking. Check your medicine. Look at the bottle before you leave the pharmacy. Here's an important question. Would you know if you got the wrong medication by mistake? Something to think about. It doesn't often happen, but it can happen. That's why it's important to take a minute before you leave the pharmacy to check your prescription. First, look at the bottle. Make sure it has your name on it. Sometimes prescriptions for family members can also be a mix-up. Check the address as well. Next, read the label carefully. Is the name of your doctor correct? Does it say what you expected it to say? Ask yourself, why am I taking this? If the answer doesn't match what your doctor told you, that's a red flag. Don't ignore that. Remember, be your best advocate. And always look at the pills. Do they look the same at times? Do they look the same like the last time? Did it change in color, size, or shape? ask the question, because when we get deliveries, we don't always get the same manufacturer, especially when it's a generic. They're always switching it. So it's always good to ask, is this the same medication? And sometimes what pharmacists will do is you'll see a small auxiliary label on it that will say, this is the same medication, but by a different manufacturer. If something doesn't look or feel right, stop and ask your pharmacist before you take it. A quick question could prevent a serious error. Another side note, when you buy your medication by federal law, and it's not, if it's our mistake or if it's a physician's error, we can take it back. But say if it's something that, no, I no longer want this medication, or I got it by, I asked for it by accident, and you walk away, we can't take the medication back. I think that's something that a lot of people don't know. The next slide. Thank you. So here's your label. How to read your prescription label. So it tells a story, right? If you look at it, it might look overbearing right now, but this is who you are. This is your medication. So let's take a look at what your prescription labels will say and what it all means. At the top, you'll find the pharmacy name. You'll always find a prescription number. And this is who to call when you call us. I mean, this doesn't look like the Mass General one, but that's okay. It's sort of a mock. But what it does is it gives you the information. You have the RX number, and that's what to call into us. Let's look at your name and your doctor's name. Make sure both are correct. Again, the prescription number, that's unique to your specific medication. In this case, the 4038114 is for test patient, and the medication is lisinopril 20 milligram tablets. It also will give the directions. Again, specific and tailored to you. In this particular case, this patient takes 1 tablet by mouth every day. And it will also tell the number of refills that you have. Refills left, 3 of 3. You'll see, and then it will go down. When it's at 0 or when it's at 1, best practice is to contact the pharmacy or contact your provider, where they will already have a prescription on file for you so that you don't have to wait. And sometimes that happens. Prescribers may go out on vacation. They may have an on-call provider. And if it's a weekend, as pharmacists, we will never not let you go without medication unless it's a controlled substance. But we're always there to help and to reach out to providers. But again, be your own advocate and reach out to your provider or reach out to us to get in touch with the provider as well. And you'll also see the quantity and the date last filled. So again, it's all tailored specifically to you. So knowing how to read your label helps keep you safe and ensures you're taking your medication the right way. Counterfeit medication. So when it comes to buying medication online, it's critical to make sure that the pharmacy is legitimate. The Verified Internet Pharmacy Practice Site Program, also known as the VIPPS, is run by the National Association of the Board of Pharmacy. This website will also help identify medication, safety, online pharmacists, and follow strict standards of quality and patient safety. I mean, here's the reality of things. You'll always see things on online. They sound great. And we all heard that adage, when you hear something sound great, it's too good to be true. So I can't advocate, we can't advocate enough to talk to your pharmacist or your doctor about it, because especially now, there are a lot of rogue operations out there. And they're illegal. We've heard a lot with the GLP-1s that are out there. They're selling counterfeit or expired medications. They're skipping the safety checks. They don't have to be approved by the FDA. So to protect yourself, there is a website, and it's right on the bottom. It's www.beawarerx.org. This website is managed by the NABP, and it helps you to find verified pharmacies and to learn how to spot fake or unsafe sites. So if it's too good to be true, please reach out to us, reach out to your provider. Again, we can always help when it comes to if it's cost effectiveness. But again, that website is very, very helpful. The www.awarerx.org. And also look for the seal of approval, the United States Pharmacopoeia, the USP. When choosing over-the-counter products, you'll see this on your vitamins, your supplements. It's an independent organization that tests and verifies product quality. When you see the USP seal on a label, that's very important. And you know that it's already been checked, and it doesn't cause, there's no contaminants such as heavy metals or bacteria that's involved. It confirms the listed ingredients are actual in the dedicated amounts, so you're getting what the label promises. And third, it means the product was made under good manufacturing practices, ensuring safety, consistency, and reliability. Not all supplements over-the-counter and over-the-counter products go through this kind of testing. So choose the one that has the USP verified seal to protect your health and make sure you're getting a product you can trust. Now I'm going to pass this on, the next part, to my colleague, Joanne.
Thanks, Petrece. So we're going to continue along with the other steps to keep in mind for safe medication use. So step number 4 is using your medication correctly. So there's a couple of different aspects that we consider when looking at this. So one is basic instructions. So taking 1 tablet twice a day or taking 1 tablet a day. So what exactly does that mean? So for a tablet or instructions that are 1 tablet daily, it's good to ask your pharmacist. If it's just once a day, do I take in the morning or the evening? Because that can make a difference in terms of how well it works. If it says 1 tablet twice a day, then getting clarification on whether it should be in the morning, afternoon, evening. Usually if it's twice a day, it should be every 12 hours. So in the morning, either before or after breakfast, or in the evening, 12 hours later after dinner or around bedtime. So it's important to get clarification on what the twice a day or what the actual instructions are. The other thing that we like to keep in mind is if a patient needs some type of liquid, and making sure they're having the most accurate dosing. If it says something like 1 teaspoon, well, what does that mean exactly? Well, if we go into our own kitchen cabinets, we know if we pull out a teaspoon, and if it's from different sets of silverware that you've received over time, it could be a different size, even though it is actually 1 teaspoon. So we really do encourage our patients to make sure that they have the most accurate dosing with their medicine. So one of the things that we try to have them do, I like demos, you can see this. So we have oral syringes. So this allows for the most accurate dosing. So in this case, it'll say 1 teaspoon, or 1 teaspoon is equal to 5 ml. So this provides more accurate dosing. Or you could also use a medication cup that's also calibrated. So this way, you're getting the exact amount that you're supposed to have. The other thing to keep in mind is if you have to use things like patches, creams, or even sublingual tablets, making sure you understand how that should be applied and how they are used. So some patches, like lidocaine patches, are used once a day, but you can put them on in the morning and then remove them 12 hours later. There are other patches, like fentanyl patches, that are used for pain, and those should be removed every 3 days. And that has to do with the half-life of the medicine, how well it works. So it's important to get a good understanding of how you're supposed to be using these very specific patches. Like with anything, it really comes down to the individual medication and knowing all the little nuances for that particular medicine. Another thing that comes up quite often has to do with creams and lotions. So how much do you apply? And so many of our patients, if it's like a small area, you can just do like a pea-sized little drop of the cream and then apply it to the area. But if you have something that is more diffuse, like a more diffuse rash, then you may need to have, several applications of that to cover the area. So it's important to ask the pharmacist how to use it. I can also think of a product called Voltaren or diclofenac gel. And in that particular box, when they give it to the patients, it has a card. And on the card, it'll say 2 grams or 4 grams. And you can actually squeeze out the amount that you're supposed to use. So that allows for more accurate dosing of the medicine. And then finally, sublingual tablets. So if something is to be administered under the tongue, putting it under the tongue, but also knowing how to use that. And I think of a medicine like nitroglycerin tablets. So that tablet, if you're experiencing chest pain, you can take 1 tablet, place it under the tongue. You can wait 5 minutes. If the pain goes away, great. If it doesn't, then you can take another one after 5 minutes. If the pain still doesn't go away after 5 minutes, you can take another one. So you can use it up to 3 times. So, but each time it really should just be only 1 tablet that you take. If after the 15 minutes, you're still not feeling well, you're still having the pain, then you should call 911. But once again, it's very important to understand the specific instructions for that particular sublingual tablet. The other thing I want to mention has to do with certain devices. So we have insulin pens and we also have inhalers that we use as well. So it's important to know how to use those inhalers and insulin pens. So I have a few inhalers. Once again, I like demos. Even though we are on Zoom, if I can show this for people, it's always a good thing. So this is an example of an Advair inhaler. So with this, we want to click it back once to open up the mouthpiece, and then you click it again, which will open up the cartridge on the other side, so you'll be able to breathe it in. And then you put your mouth up to it, and then you can feel it go back, and it'll go down into your lungs, so it'll help you breathe better. And usually the Advair inhalers are 1 puff twice a day. There are different inhaler formulations available now. And so it is important to know and ask your pharmacist how to use that particular inhaler, because there's all different formulations. We have, for some patients who it's difficult for them to breathe in the inhaler because they just don't have that capacity to do so. There are other inhalers like the CombiVent Respirant that you can press down and it's a spray and it'll go into your mouth. And so that way it'll be, for those who have a difficulty breathing in, you can use that and it will help with your breathing overall without having to take that really deep breath. The other thing I want to mention has to do with the insulin pens and just insulin in general. Some of our patients may have difficulty drawing up insulin from a needle and the actual vial. So we do have insulin pens that we're able to click for patients. So it'll say what the dose is. You just turn the dose to what you need, and that way you'll be able to inject it for the correct dose. Some patients have difficulty seeing the lines on the insulin syringes, or maybe they have a tremor, so it's hard for them to pull back on the syringe itself. So we want to make sure they have more accurate dosing. So having these other products available, like the pens, allows for more accurate dosing. Another thing that we like to offer our patients to help with the proper use and making sure they're taking it as prescribed is that we have a couple of different tools that we like to share with our patients. One would be a weekly pill box. So as we have in the middle screen, it's listed as Sunday through Saturday, and then you can take it morning, afternoon, evening, and then bedtime. And for as you see in the middle cartridge, you can actually take out that particular dose, that day's doses. So if you had to go to doctor's appointment or had a family event, you could take that with you. And this way you have the medicine that you need for the day, so you won't forget to take it. So it'll be available for you. There are also other devices like the pill boxes, the vial here that does have an alert. Those are a little bit harder to come by. So if you needed to take a certain medicine, instead of taking a lot of the vials with you, we have other tools that we can also use for patients. We have these blister packs, and a lot of the pharmacies offer these now. Oh, there we go. So it's Sunday through Saturday. And you can do same thing, morning, afternoon, evening, and then dinner. And the pharmacies will fill up each one of the individual pouches for those doses. So if you have to take, 8 medicines or 10 medicines a day, they will put that morning dose all in one slot. So you can just pop out the dose that you need for that, for that morning dose. And then the same as you go through the day. So some patients will use these blister packs. There's another device, another box that we have here. This is a pill dispense, and these come as little pouches. Let's see if this comes out. So it comes out as a little pouch, and you can just rip off the pouch itself and then use scissors to be able to open it up. And then that way you'll have that morning dose available. Some patients have difficulty popping out each of the individual pouches on those blister packs. So this device tends to be a little bit easier for some patients. Each pharmacy has their own kind of blister pack or their own dispensing system. So it is good to kind of like, do some research or, talk to your local pharmacist and see if there's anybody that they would recommend to provide those services. So we have those devices. We also have medication alarm clocks. So this is the Med Center alarm clock. It's a talking clock, and we can set it for up to 4 times a day. And when your dose is due, the little lady in the box says it's now time to take your medicine. And you can press the little button once the alarm goes off when you're supposed to take your medicine. Many of our patients use the two of these together. So the alarm will say it's time to take your med, and then they just pop it from the blister pack itself. So that is certainly options for, some patients. Or some patients may also need to have just a med dispensing device. So as we see here, this is kind of like a little bit of a spaceship. And I think there should be like 28 slots in that. So 4 times a day for up to 7 days. Or if somebody needed to take it, if they were only taking meds like once or twice a day, then it could last 14 days. But sometimes the challenge is trying to get somebody to be able to fill the med dispensing device. Some patients are not able to do that. So they may need a family member to be able to do this. But these are all certainly tools that can help patients with medication adherence so they can take their medicines as prescribed. The next step that we're going to just talk about really has to do with the medications themselves. So just being aware of the medicine and some of the side effects. 1 in 5 medicine patients may take a medicine that may not be the most appropriate for them. So it's important for them to understand, and that's what we're going to talk about, going forward, some of the medicines that patients may take, that there are side effects associated with it. It can put patients at risk for falls. It might cause them some drowsiness, maybe some change in mental status. So just being aware of the new medicine that you're starting and knowing what the side effects are going forward. So there are a few meds that we just like to bring to people's attention so that way they're aware of these. We have a list, it's called the BS criteria. It's been around since 1991. It's been reinvented a few times, but ideally when it started out, it was a list of meds to avoid in the elderly. So benzodiazepines, and the meds that are in that category would be like Ativan or Valium or Klonopin. And those put patients at risk for, drowsiness, falls, those sort of things, as do barbiturates like phenobarbital, or narcotics like some of the pain medicines like oxycodone or Percocet. So it is important to keep in mind these medicines do put patients, older patients at risk for side effects. So we just want them to be aware. It may be appropriate that somebody takes these medicines if they have, if they had a hip replacement, they certainly need to have a pain medicine to control their pain. So there is a level of appropriateness for this, but we just want to make sure patients are being monitored appropriately while they're on this medicine. There are also over-the-counter and herbal products that we want patients to be aware of. So Benadryl, and I can honestly say Benadryl is one of the meds that's top of my list that I don't recommend for any older patient. It puts them at risk for drowsiness, blurry vision, difficulty going to the bathroom, whether it's urinating or causing constipation. So this is one medicine that we are really very careful of. And just going back to what Petrece said before, we had shown that Tylenol PM bottle. And so sometimes patients want to grab Tylenol, and unfortunately they might grab the one that says PM. And that's when they may run into some problems if they're taking it multiple times a day, that it might make them feel very drowsy if they're taking that particular product. So just be aware of Benadryl, because it is in many products and it can cause these effects. Sudafed is another medicine that can cause an increase in heart rate or blood pressure. So if somebody does have high blood pressure, then we recommend not using that. And then herbal products like ginkgo biloba, ginseng, garlic, those can put patients at risk for bleeding. So once again, it's really important to talk to your pharmacist before you start any of these herbal preparations to make sure they don't interact. Which leads us to the next slide. So just being aware of drug interactions in general. So medicines like Coumadin or warfarin, they can interact with antibiotics. Antibiotics and Coumadin, that's one combination that, I mean, you can take it, but you have to make sure that your Coumadin manager is aware of this, because they may need to adjust the dose during that time period. Cholesterol medicines may also interact with some antibiotics, so that's something to kind of keep in mind. Corticosteroids, so prednisone, may also interact with some antibiotics. And then alcohol is one product that we do not recommend taking with any medications, because we just don't know how it's going to react with what you take. So we really recommend avoiding alcohol when you're on some of these medicines. And then certainly herbal products, as I mentioned, the ginseng, the ginkgo, they can interact with the warfarin, causing increased blister reading, bleeding. And then kava kava, which is used for anxiety, that can have a toxic effect on the liver. So if you have a liver condition, you want to make sure that you're not using this, and talking to a pharmacist to make sure that anything new that you're starting does not interact. And the same with St. John's wort, that can interact with medicines that are for depression and blood pressure. So make sure that you talk to the pharmacist before you start any of these products. In general, it's just really good to have good records. A lot of our patients, they are just very strong advocates for themselves. They have a very active role in their own health. They have notebooks that they use. Some use notebooks, some people use like the notes app on their phone to keep track of things. And this is important whether you're going to the doctor's office and you have a list of questions that you have for your doctor. You can be prepared when you go in and meet with them, or when you are starting a new medicine. And this is what we advocate for our patients, is that writing down that new medicine, understanding what it's being used for, what the dose is, how you're supposed to take it, and then obviously write down the start date that you start taking it, because as you're going along, you want to make sure that it's working for you and that you're not having any side effects. So if it's a medicine that you're starting for blood pressure and you're also keeping track of your blood pressure, you want to make sure that you see like, okay, I started this day for my medicine and my blood pressure going forward looks like this. So you want to make sure that you can keep track and see that your blood pressure is going down in the right way when you start that new medicine. There are a few other tools that we recommend for keeping track of your records or just your medicine. So in addition to having the notebook keeping track, if you want to have a medication list and keeping it in your wallet, that's a good idea. And also writing down drug allergies. So if you're allergic to a certain medicine, that's important to have that written down. We also recommend either having a copy of that med list on your fridge or giving it to another care partner. So whether it's a spouse or a child or some other caregiver, so that way they have the copy of the med list. So if for some reason you were hospitalized, that caregiver could have that med list available to share whoever was taking care of you. And if you had the med list on your fridge, if for some reason EMS had to come into your house, they would see that on the fridge, and then that would help them understand like what might be going on with you to help in treating your condition at that time. This is a list that we share with our patients. So this is a chart that I've actually compiled for our patient. So it gives the medication name, what dose they take, why they're taking it, and how they should use it. So a similar chart or graph could also, you can go online, you can go to Google and actually like print out one and then handwrite in the medicines and why you're taking it. And once again, this is a good tool for yourself to help keep track of why you're using the medicine. Step 7, as we go along this little journey, so just making sure that we're asking questions, so asking the doctor if, you know, about the medicine in relation to your condition, and then certainly asking your pharmacist if you have questions about, you know, the side effects, or you're not sure how to take it. If the medicine's not working, that's when you want to let the doctor know as well. Maybe the dose needs to be increased. And then certainly if you have concerns about costs, there's a lot of different options. You know, we have patient assistance programs through the manufacturer if it's a brand name medicine, or we also have other copay programs in Massachusetts, like under Health Safety Net, which is part of Mass Health. So there are options to be able to help with the cost as well. So med storage. So where are we keeping all of these meds, and what can we do to make sure that it's going to be the safest storage for them? So we know a lot of patients keep their meds in their bathroom or their kitchen, and we really recommend keeping it in a place where there's not a lot of temperature fluctuation or a lot of humidity, because that could certainly affect your medication and how well like the stability was. So keeping that in mind. So keeping it either in your bedroom or some other place where there's not going to be a lot of temperature changes is really important. There are certain medicines that need special storage, so whether it goes in the fridge, so some insulins may need to go in the fridge. So, you know, the pharmacy usually puts like a little blue sticker saying refrigerated item, so that's important to know. So when you do get it at home, you want to make sure that you do put it in the fridge. There are certain products that also need to go in the original containers. So things like nitroglycerin have to be stored in the manufacturer bottle, which is brown, because otherwise it gets, the brown protects it, the amber bottle protects it from light, which could affect the stability of it. So you want to make sure that you keep it in the bottle and not go in another separate vial. Insulin certainly needs to go in the fridge, but you can also, the syringe pens that we have, those can also go in the fridge as well. And then for some patients, they may want to keep their pain medicines, their narcotics in a lockbox if they have concerned about safety or having somebody else have access to it. And there's a photo down here which shows some lockboxes that might be available for some patients. Medication disposal. So if a medicine is stopped, if it's been discontinued and you no longer need to use it, so what do you do with it? And this comes up quite a bit. So if it's something like a tablet, you could mix it in with like kitty litter if you have a cat. I get that a lot. Well, I don't have a cat. Where else do I put it? Or coffee grounds. And some people say, well, I don't drink coffee. What else do I, where else do I do it? But we really recommend, you know, not, you know, mixing it or flushing it down the toilet, because that can really affect the water supply. And we've actually seen that in years past. Many years ago, when a lot of women stopped taking the estrogen tablets down in Washington, D.C., they found that the male fish in the Potomac River were actually, they were having eggs. So they were birthing eggs, and that had to do with the Premarin tablets from the estrogen. So it really can get into the ecosystem. So we don't recommend things getting flushed down the toilet. Instead, we recommend having proper medication disposal. So there is what we call the DEA take back days. So twice a year, the DEA has certain locations in towns, either at police stations or DPW, and you can go and drop off unused medicine and it will be destroyed properly. Or here at the hospital at Mass General, we have med disposal boxes. So there's a box right across from the outpatient pharmacy, and it says med disposal on it, and you can put your medicines that are no longer used in there. If you want to take the label off, take your name off, you can certainly do that, but it is incinerated and it is properly disposed of. So other people would not have access to that. Really, you know, as we kind of like wrap things up, I'm keeping an eye on time because I want to make sure that we get some questions we can answer, any of the questions that you have. We really want to make sure our patients understand the meds that they're on, why they're taking them, If they have any questions, they can ask their doctor, they can ask their pharmacist, because we really want to make sure patients are using it properly. So that way they're in their best health. They can do the best that they can for themselves and get the most out of their medication. So really, it's just important to be an informed patient, ask questions, document, either have the notebook or the notes on your phone that you can put information in. So that way you can keep track of the meds that you take and make sure that if you are having side effects, we can figure out which one might be causing that and make adjustments as needed. But really having that, engagement with your pharmacist, knowing your pharmacist, I'm really happy to be here today because it's National Pharmacy Week. So when we were looking at dates and trying to, sort things out, I was like, well, we have to do this week because it's, National Pharmacist Week and Pharmacy Staff Week. So we want to make sure that, our patients know that we're available here to provide the education to them and answer any of the questions that they may have, which is our next segue. So I would love to hear any questions that you may have.
Thank you so much, Joanne and Petrece.
Thank you.
We now are at the end of the session. If you have any questions, feel free to enter them in the chat. We have a question from our participant asking if you can further explain what half-life means.
Half-life is the time that it takes for the medication to no longer be working within the body. So some medicines, the half-life will only last for like 6 hours. Some medicines may last 24 hours in the body. So it's the amount of time that it stays in your body and works. Great question.
You provided some wonderful resources earlier on. Is there a cost to patients if they want to request for medications to be dispensed in blister packs or tear-off pouches?
So it really depends on the pharmacy. So I have a list that I use for our patients. I think it's got like 60 different pharmacies on there. And some pharmacies have no charge with the blister packing, and then some pharmacies do. It really has to do with the area and the pharmacy that you're working with.
Thank you. Where can one dispose of medication sharps in particular?
So there's a sharps container that you can get at your local pharmacy. And so you can put the used syringes into the sharps container and then it can go out with your recycling.
But if they don't want to buy that, they can also put it in a old bleach bottle as
Or
well.
milk cartons, milk bottles, they'll use milk bottles.
And so what you would do is just like leave maybe a little, say, for example, I mentioned a bleach bottle, and then put them inside and then put like duct tape around the top of it and dispose of it that way.
Thank you. And we have an interesting question from our participant. I don't know if you have any resources you can share for patients where a lot of the insurance coverage is changing. And if you have any resources on, where can one go to if they're going to be losing coverage on a particular medication?
So I know that some of the pharmacists within the MGB system have created a document for the prescribers, for the doctors specifically. So really reevaluating each of the patients, see where they're progressing, and then making other suggestions, going forward. So it's a very, there's an algorithm. So there's a whole stepwise process determining what's going to happen. If this person no longer has coverage, what are the other options? So it's not just a straight, like simple sort of thing. It is a very robust process.
Sure. Thank you.
I always love this group because you guys are so educated and you ask such great questions.
At Mass General, are there any programs or resources where a person like yourself would actually be able to sit down one-on-one with the patient to review their medication list?
Yes, we do that all the time. At the outpatient setting, all you need to do is just ask, come in with your medications. What I always suggest to patients is call a day ahead of time. And there are patients that will ask for me. And I would say, hey, can someone sit down with me and, put a time on the schedule? when you can come in, and we'll gladly sit down, and we do that all the time. In our department, we have pharmacists that are on. We have that speak, I want to say, maybe 10 to 12 different languages. So we can help everyone and anyone.
That's wonderful. And how about for print instructions? Are you able to provide information like on how to take their medications in languages other than English?
Yes, yes, not on the label. The label, it's only in 2 languages, English and in Spanish. But we also have is what it's called Meducation. And what it will do is it will just basically take all the information along with the label and then put it right on this piece of paper. And it'll also mark it out at the time of day as well. And we have that in 36 different languages.
That's great. So I think we are just about out of time. Thank you so much, Joanne and Petrece. Before we end today's session, do you have any final thoughts you'd like to share with the audience?
Go ahead, Joanne.
Oh, I was gonna say,
Yeah.
I mean, this isn't, like I said, it's National Pharmacy Week. So get to know your pharmacist. If you have any questions, please feel free to reach out to them. The other little plug that I want to mention, we are having more pharmacists in primary care. I actually covered 20 different practices for the integrated care management program myself. The role has changed a little bit, but we still will meet with patients. There are certain pharmacists that are assigned to certain practices here, and they can always meet and go over some of those medicines as well, in addition to the outpatient pharmacy.
Exactly.
Wonderful. Thank you so much. This was all extremely helpful.
Thank you. And
Thank
it
you
was
for having us.
Take care. Have a great day, all.
Thank you. And for everyone joining, thank you so much for your time. As I had mentioned, today's session is being recorded. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone. Take care.
Thank you.
Thank you.